Yes. Hello, good evening. How are you? Welcome to the first live Sunday of the month of December 2025. How are you doing? This is Ask the Doctors program. And this program holds every Sunday by 8 p.m. Nigerian time. I hope you can hear me. Let me be sure you can hear me. My name is Dr. Frederick Unwibohai. People call me Dr. Fredosta. I'm a licensed medical doctor. And on this program, we teach, we answer questions, and today's session is a question and answer session. And this program holds Okay, good. So today is a question and answer session. We're taking your questions, we'll answer you. Well, as always, we'll beg you that if you have any medical condition, please go to the hospital. So how are you and where are you watching me from? If you can hear me and if you can see me, you can tell me where you're watching me from. We are live on Facebook. We're also live on YouTube. Yes, my co-host is Dr. Israel, and he will be joining us very soon. Any question you have for me, please drop it in the comment section and I'll try my best to respond to you. Once again, we will not treat you online. Go to the hospital. We will not diagnose you here. Yes. And finally, share this video and invite your friends. So tell me, where are you watching me from? My people on YouTube, do I have anybody on YouTube? Yes, I have some people watching me right now on YouTube. I'm watching from Lagos. I'm watching from Lagos. Charles Diamond, how far? How are you? Where in Lagos are you watching me from? Oh yeah, tell me where are you watching me from? You can drop your questions and we will try to respond to you. Yes. Okay. Let me see if I have any comments here. There is no comment, Abby. Okay. I'm watching from where? I'm watching from Abuja. Joshua Nelson is watching me from Abuja. Joshua, have fun now. Let me see if I can go live on TikTok for a while. Let's see. Let's see if I can go live on TikTok. Let me see. Okay. Yeah, I'm live. I'm live on TikTok. Yeah. I'm watching from Lagos. Who be this? Olakunle is watching from Lagos. Janet Ebunoluwa is watching from Ibadan. Watching from Lekki, okay. Jeremiah from Port Harcourt. Let me see. I'm good. Good evening. Dr. Israel is in the house. Dr. Israel is in the house. So I want to bring him up. I'm watching from Akwa Ibom. Dennis Umore. Dennis, how far now? Ask your questions, or if you have questions for me, please do so. Dr. Israel, if you are ready, give me a thumbs up. Okay. Yeah. Dr. Israel, good evening. How are you?
Good evening. Happy Sunday.
Yes, happy Sunday to you. Somebody says, just watch your video on deworm. Any drug you can recommend, just go to the pharmacy. Kunle, just go to the pharmacy. Tell them you want to deworm. It's been a long time you deworm, and they will give you. You understand? They will give you one. Go to the pharmacy. I mean pharmacy. They understand. Yes. Tell them you want to deworm. It's been a very long time. We are taking questions and answer today. If you have any question for us, start dropping them down. Dr. Israel is ready to respond to you. I'm also ready. We'll try to be very fast. We will try as much as possible to be very fast. Who be this? Nonye from Anambra. Good evening. Ife is watching me from Lagos. Cyprian from Cape Town. Umez from Anambra State. Oh yeah, let your questions flow in. I think I'm also live on TikTok. I'm live on TikTok. Yes. Where are the people that are watching me live on TikTok? Where are they? Okay, they are here. Let's just stay online for them. Let's see. Okay. Okay. Let's see. Let's do this. Let's see. Oh God. Okay. Dr. Fredosta, I sneeze a lot and headache too. You sneeze a lot. Let me pin the question on the screen. Dr. Israel is here. Dr. Israel, are you back? Can you hear me?
Yeah, I can hear you.
Hello. Okay. He's not.
Hello, can
He's
you
here.
hear me?
Yeah. I can hear you now. I can hear you now. Yes. So this person says I sneeze a lot and headache too. Your name is Charles. Charles, wetin dey cause your sneezing? I think you might be reacting to something. Sneezing is your body. Sneezing na sign say your body no want something in your system, and most times e fit be allergy. So when you dey sneeze frequently too much, e mean say e get things around wey your body no like. Those things na you need to find out and avoid them, because you cannot be taking medication continuously. So find out, is it the weather? Is it your apartment? Is it where you live? Is it your pets? Is it where you work? E get something wey dey cause that sneezing. You must find out. If not, e go definitely continue. Okay, let's see. Good evening, Abigail. Good evening. Dr. Israel, can you hear me?
Yes, I can hear you.
Okay, somebody's asking us a question here, though I'm not going to put on the screen. It says, what medicine can cure penis rise and fall? Bro, go to the hospital, yeah? Yeah, go to the hospital. Go to the hospital. Dr. Israel, this comment says, I have a question regarding urination. I often urinate sometimes. The frequency is much. Abeg, you want to respond?
Okay, when you say you dey piss and you dey piss well, is that you need to, there are different things we need to find out about that your urination. One, if you dey piss, e dey pain you. And if e no dey pain you, you dey drink many water. If you dey take so many water, e mean say you go dey piss well. You dey on any medication? Mostly there are some antihypertensive medication wey fit dey cause you to dey piss well. How old are you? That one go also make us know if there's any other thing wey we go tell you concerning that your piss well. You don try go check your sugar? If yes, if they say e be you dey get waist pain or back pain. So these are so many questions you need to answer to even know anything concerning that your urination. However, if you be saying you dey drink water well and you dey urinate well, na normal thing. No stress yourself. Yeah, but if not, you need to visit your doctor, make them investigate every other reasons so that they can actually get the main reason why you dey urinate and then treat you.
Okay, now make we just talk this thing here. Abeg, if you dey get this kind of problem, you go need to see your doctor. They go ask you plenty things, plenty things. We examine you before we go come think of the type of test to recommend for you. Sure, you understand? So you go need to see your doctor, make them find out. But if you dey drink water so much, just like Dr. Israel mentioned, that might just be the reason. Yeah. Okay. Let me see. Evie Gloria, how are you? Good evening. Yes. Good evening. Let me see. Okay. I dey check for the questions though. If you are just coming, you dey welcome. This na Ask the Doctors program every Sunday by 8 p.m. to 9 p.m. Abeg, we no dey private chat anybody, we no dey give anybody phone number to call. If you get any medical condition, abeg, you go hospital. Here no be hospital. Na just to clarify anything wey you wan ask. Somebody says, doctor, please, what is gastroenteritis? On the following heading: definition, signs and symptoms, clinical manifestation, nursing intervention, clinical management, the way forward. And this is not for this platform. This is not for the program. Do you understand? Abdullahi Ibrahim. If you are asking this in a special program, we will answer you. But here, we are not talking about gastroenteritis, because this your your outline. We take over this live session. So we not go fit start to define, they tell you signs and symptoms. This is something that you should study privately. But if you want to us talk about it, that is a separate topic that we might discuss one of these days online, but not today because this outline is quite much. I don't know if Dr. Israel wants to add something to that. Dr. Israel, your network don't hook. I know they hear you.
Sorry, I mute myself. Did they hear me now?
Yes.
Yeah, okay, sorry, I muted before. So as I was saying, I said if you want me to talk that one, that's a full topic of its own. So that will be maybe another day. We can actually just take it as a topic and talk about it, but not today.
Not today. If you never share the live session, I go ignore your question. I go ignore your question. If you share the live question, if you share the live session, then I go take your question. But if you never share, no worry, I'm not go take your question. Because this one now I don't understand the kind this be this. Let me see. Yeah, good evening, Betsy. Happy Sunday. Yeah. Happy first Sunday. Not so. Who be this? It says, good evening, watching you live from Sierra Leone. Hi, Sierra Leone. Okay. I am feeling back pain always. Dr. Israel, I beg, respond to this guy.
Okay, the feedback pain always you want to sometimes many things feel they cause back pain. And one of the thing and the kind lifestyle, which kind of work you they do. If now work when you they sit down all the time, it go feel the cause back pain because sometimes your sitting position may not be the right sitting position. If mostly if you know they sit straight into your chair, and you know they sit down straight into your chair, it go make you they get back pain. So what you need to do is that when you sit down for some time, sometimes you say stand up, stretch your back before you go back to that sit down. If now stand, you they stand all the time, if it still cause that same back pain. So you still need to sometimes sit down or move your leg up and down, then you go reduce the back pain. You injure the back before, they do surgery for you before, saying that back they can't chew, they can't put needle to stop pain for your body. Apart from the back pain, get another thing when they follow the back pain, the pain from the back, they enter your legs, and all those are some other things you need to find out. So if you figure those things, then you go actually need to see your doctor. Now your doctor will come tell you which medication you go take. But if now because of how you take the sit down or how you they stand too much, or you they lie down for one place or just they try change your position and they stand up, if not too much sitting down, then the pain go they reduce gradually. Dr. Fred.
Thank you for that. Let me go to the next question. Good evening, doctor. Please, what are the symptoms of low egg quality in a woman? What are the symptoms of low egg quality in a woman?
Yeah, I don't know how to answer this question, but I think that when the person does they get low air quality, mostly if you don't the old, sometimes now that time that person they quick get that low air quality. You can't be like say it already they close to menopause. Sometimes infection can actually affect the egg production. Sometimes if the person already get problem to the ovaries, it can also affect the egg production. But there may not be any symptom. You may not see anything. You may just be normal doing your normal thing. So now for you to go do tests, investigations, check the eggs, that is when they will really know if there's anything wrong with the egg or not. So I will advise him, you know, the way to know what to be the signs and symptoms of egg problem, whether the egg they well or not they well. I will advise say if you did notice say, oh, you never feel get belly for a very long while, go hospital, see a gynecologist. Gynecologist now doctor when they specialize in women. See a gynecologist, then they go follow you up, and hopefully you'll be pregnant. Dr. Fred.
Yeah, thank you. Now, Dr. Israel, they know they share the live session on Facebook. So make I see whether I fit answer one person for TikTok. And then if they no still answer, if they no still share the live session, we go just they find one gist. Do you understand? Because as you they try respond to them, the
Okay.
least that people can do now to share, but they are not sharing. You understand? But they can ask you. So make we maybe just the observe right now. Somebody says I'm feeling lower abdominal pain. I had a laparoscopic surgery 3 months ago. The pain is back again.
You say?
He say I did a laparoscopic surgery 3 months ago and was having lower abdominal pain. Now the pain is back again.
Then you go back to the hospital again. Alright? You go back to the hospital again so that they will check you. It may just be a different pain. It may just be a different pain, but causing the same pain. So you need to go back to the hospital so that they will see you and then they will check you.
Yeah, that's the best. Please go back to the place, the same hospital that you started this whole story, so that they can check you and find out what it is. That is the best advice we can give to you here. Not for you to go online and be looking for solutions. No, please go to the hospital. Yeah, let me appreciate Betty. Betty on YouTube. Betty, ask me question now. Betty on YouTube just sent us a thank you gift. So Betty, thank you. Ask me question, make I respond. May we respond to you, I beg. The rest people are stingy with their share. They don't want share, but they ask me question. Okay, let's see. Let me take this question. It says, Doctor, my 6-year-old girl is always complain of stomach ache, and we have run lab for her for kidney and liver, and it came out normal. She complains of her body scratching her. Please, what can be the cause?
Okay, when children they quick complain of that stomach pain. It's one of the thing when young children they quick complain of. Yeah, so you need to watch what you give them to eat and all that. So I cannot just tell you say now this will be the cause. So no, I will not know the cause, and because we need to answer a lot of questions before person may be thinking about what is the cause or what is not the cause. But just know that yes, children always most children complain of that abdominal pain where we're done and one of their symptoms when they quick complain. And sometimes you will check everything and you will notice that there's no thing really that's actually causing that pain for them. We know of that as well. So for that body itching, we will also try to find out if not only she they have that body itchy or people around us they get the itchy. And then now when he bath or when he never bath, then they get the itchy. Is there rashes in our body? Because if there's heat rashes, there will always be heat itchy. Everybody go to scratch am most of the time. So these are some of the things you need to find out before anything, because sometimes those itching or those scratching body fit just be because of the heat. I feel because they react to one thing or the other, that make it they feel am. Yeah, Dr. Fred.
Thank you, Dr. Israel. If you just they come, this is Ask the Doctors program. The program holds every Sunday by 8 p.m. to 9 p.m. on Facebook and YouTube. We've been on this program for more than 5 years now. Every Sunday we are here. On this program, please, I beg, we know the treat online. You go hospital. We they teach, we they respond to questions. Something we know they clear to you. But if you they find treatment, you go enter hospital. I beg, yeah. We know they give number, we know the private chat, we know they're here to find patients. We are not here for patients. We are not desperate for patients. We're just here to teach you and disappear. Do you understand? Thank you very much. Hi, Doc K. I want to add weight. How can I do that? So my question to you is, why do you want to add weight, first of all? What makes you think you don't have the normal weight? Because a lot of people will tell you, say, I want add weight, I want add weight. And when you check them, then they're within the normal weight. But because of people around them, you are not fat. Why you be like this? So you might just be within normal. Why do you want to add weight? Are you underweight? Now, if you want to add weight, the best thing for you now for you to eat, waiting you the chop, and then you can do muscle building exercise. There are certain type of exercises that you need to do that will help you build muscle mass. That will make you add some kind of weight. But there is no medicine that you will drink that will make you gain weight. Those medicines go by you. So eat well, eat 3 times a day, 4 times a day, it depends, and try to exercise. Muscle building exercises might help you. Eat protein, eat more protein, take your milk and the rest. You go need to chop. But if you know they eat, why you won't gain weight? Oh, but doctor, now I don't they chop, they chop, they chop, they come. I don't chop the whole house, but yet I know still add weight. I don't do all the whole gym, I know still add weight. Then that is your body, that is your gene. Now so your body be. Now so e dey for you, now follow come. So you don't need to panic and start looking for other things that will put you in trouble. Just leave your body the way you are, because you get some people, no matter wetin dem chop, dem go still dey slim like that. You need to speak with your doctor, make your doctor find out where you dey, whether you be those people wey be slim or you need more intervention wey we don give you here. Dr. Israel, anything to add?
No. I think that's fine. Let you talk. It's okay.
What causes irregular menstruation? Abeg, respond.
For irregular menstruation, different. Sometimes many things they cause that. Some na normal, some na the person, and so the person just be. You know they see the period as as it's supposed to be. Two, now hormonal problem. So sometimes the hormones are not being produced the way it should be produced. So as of that period, you can have irregular menstruation. Three, maybe you take some medication. Some medication can actually cause that as well. Mostly those people where they take some hormone type of medications or some other kind of medicine. There's some medication that can actually affect your menstrual cycle. And for maybe you don't you get belle, the belle cock, or you the something can happen, or you by yourself goes remove the belle using medications and all that. If it's cause using pills and all that, if it's cause if it make you kind of get irregular menstruation. If you use contraceptive, that is, you they use family planning, yeah. If it's make you kind of get irregular menstruation, and I think then your weight is also part of it. If you are obese, that is your weight too much. If it's make you to get irregular menstruation, then if your weight still too small, yeah, even when if your weight too small, if even make you never see your menses again, if your weight too small. So these are some of the things when it cause irregular menstruation.
Thank you so much, Dr. Israel. Finally, to that, abeg, if you think say your menses don dey irregular, you don try enter hospital not sit down for internet dey find solution. Here we just list the points for you. Somebody says, are you taking questions here? We are taking questions on TikTok, on Facebook, on YouTube. Do you understand? We are taking questions. Dr. T, I see you. Good evening. We have Dr. Temidokbe in the house on TikTok. Ask your questions. But if you no share this live session on Facebook, I no go take your question. I no go read your question if you no share. Because do me, I do you. God no go vex. Let's take this question. Please, what is the difference between white vitamin C and the orange vitamin C? Which one is effective?
Actually, there's no difference. The two are the same thing. Now just the color, now just different. Yeah, the two are vitamin C. They not get any no one day superior to the other. It's just that and the flavor now you make them different. Yeah, the flavor now you make them different. Mostly for the orange vitamin C, they just add that orange flavor so that when you take her, so because some people know they like that sour taste, that's why they added that orange flavor to it. So, but there's no different. Now the same thing. So not worry about which one get power pass or which one not get power. Now the same thing.
Thank you for that answer, Dr. Israel. Let's move very fast. Ivie says, I share. Ivie has been a long time follower. Ivie, how you doing? How is your family? How are you? Let me see. Doctor, my fasting blood sugar is 111. Is it normal? Fasting is 111. So, they be something wey go make you panic, but it don't dey near abnormal. It's a little bit deranged. You understand? A little bit. It don't dey waka go where go come make am true abnormal. So you are in the right stage to do something about it. I believe I made a video about this. Exercise what you eat. Exercise would help you control your body weight, watch what you eat, and sleep. These are things that can help you. I don't think you need medications in this point right now or at this point. These are a few things you can do, and then monitor. You are not diabetic, but you are close to becoming. You are in the perfect stage right now to do something about it to help yourself. Well, why they speak Oyibo grammar? Dr. Israel, abeg, answer this thing. Make my brain change. I need to configure my brain. No vex. Help me. The page no one come
Okay.
out from them
No,
immediately.
you don't actually answer one. The blood sugar of 111. The normal is from 60 to 110. So for you to have is it 60? Yeah. For you to have 111, it's not really one thing we should be worried about. As Dr. Fred talk, just try mind what you they eat, and also apart from minding what you are eating, you need to just continue to dey check the test and the check am all the time. Because if you dey check am all the time, you go overfit, you go always fit you go always fit sorry you go always fit control am well. So no fear, no worry, nothing dey do you yet. But it's a right time for you to go dey check am all the time.
Okay, let me see if we get any question for TikTok. See whether we get any question for TikTok. I have rashes that go and come back. This person is who? Matthew. He say I have rashes that go and come back. Always on my back, my head, my beard area, and chest. Rashes where they go and they come back.
So that rashes where they go and they come back, wetin you dey take where they make am go? I believe say you dey take something na they make am comot. And how is that rashes? It dey scratch you well? And then another question. Then is there a particular time where you think say it take dey come? E get particular time where e be say na that time e take dey come enter your body, or na anytime na e dey come? So these are some questions wey you need to answer. But you need to see a dermatologist, doctors wey dey specialize for skin. You need to see them so that make dem fit carry you through some maybe investigation, some tests, and know wetin exactly dey cause that rashes, or which how the rashes be for your body. Then they will know how to take manage am for you.
Okay. Doctor, what is the essence of taking TT, tetanus injection, during pregnancy? Does it have any side effects?
Tetanus injection is very important because it dey protect you. Also, they protect your unborn child, and mostly during the time when you want born and all those things. You not get any side effect when I mean not get any side effect, not get any side effect that is so severe that can affect you or your baby. But no drug will not get side effect. So maybe when they give you the injection, that place will pain you, will make your hand weak for some time. But TT no go fit affect your baby. So, and it is very, very important. In fact, for every pregnant woman, you are supposed to take for every woman where they in childbearing age, you're supposed to take 5 doses of TT. Yeah, 5 doses of TT. You take 2 for one pregnancy, the third one and then remaining 2. And you get they do the schedule. But sometimes for Nigeria, we just notice some women, they know they go complete their schedule. They know they go complete, and so most hospital go just say once you are pregnant, they just give you 2 doses. Every time when you are pregnant, they just give you 2 doses. However, if you are completed your 5 dose scheduled, you are protected against tetanus for a very long time, for life, and you are never supposed to be taking those 2 doses again. However, even though you still take those 2 doses, it not be say you get any effect, or not be say you go can't cause any problem for your body. But that's how it should be, and that's how it should be. Dr. Fred.
Thank you, Dr. Israel. After this question, we'll go on a break. We'll go a break, a personal break. And when we come back, we'll continue again. So let's take this question from Peter. Good evening, doctor. What is the cause when I penetrate during mekwe? 30 seconds, I don't release. What is the problem? What is the problem? I don't know whether you follow me, Peter. I don't do video about this. You understand? I make a video, and for that video, I list some of the things where you feel do as a man to try and help you. And we notice, say, it gets some young men. They don't try everything yet, in all the work. You will need to see doctor. Do you understand? 30 minutes, 30 seconds is quite very, very short. So we gonna need to speak with you, know wetin dey happen, know whether you don't marry, know whether you take medication before to take mekwe, know your lifestyle and many things. We'll come find out. Your doctor will come give you some techniques, advice wey go help you, so that before you start the mekwe sef, you can do these things to help you. Do you understand? But 30 seconds is quite ultra short. So there are a lot of things we need to find out. And I don't think this will be the best platform for this. I don't know if Dr. Israel won't address this.
You need to see a urologist, and doctors will get when they specialize in that aspect. Also, I will advise say you also need to remove your mind. And sometimes when you want make your mind is always there, like, hey, I go soon come out, I go see, it go soon come out, it go soon come out, it go come out. But when you try to remove your mind and enjoy the process, sometimes you likely stay longer than that time. Yeah, you'll likely stay longer than that time. So sometimes it's your mindset, sometimes it's things that you have taken out, things that have happened around you. And so see a urologist, and they will help you better.
Okay, let me now talk about this personal break right now. For everybody where they post video on social media, for all of you that are posting video, especially those of us who never learn anything about social media, I dey use the opportunity beg you, no continue if you never learn anything. I'm serious. It's not compulsory you get my course. No continue if you never learn anything about social media guidelines, community guidelines, copyright infringement, what to post and what not to post. I see a lot of you on social media. Dr. Fredosta, I like your video. I post them for my page. Your page go destroy, it go spoil. And they beg you every day. Don't do it. Learn. But people think, say, we dey here, they find their money because of course. No, it can never be free. Get this course, it will help you. Because it dey pain me. I see how much you put energy on your page. One carelessness, you go just lose your page, and it's not nice. You post my video, my admin go strike your page. So I'm begging you, don't. Go and learn. Get this course. See the code for your page. Scan this QR code. Scan it. Scan them. Pay for the course. Watch all the videos. About 6 videos. 6 or 5 videos. There about 10,000 naira. Very cheap, so that you go feel afford them. Next year I go change the amount. And you understand. So go and get it. May help you. Not be say tomorrow you come dey disturb me, Dr. Fredosta, help me. I no go answer you. I no go lie. I no go answer you. So I beg you, go and get the course. Whether you are watching me on TikTok, on Facebook, or on YouTube, irrespective of where you're watching from, get the course so that it go help you. You hear me? So good life. Good life now waiting. Good life. Na sense. Let's continue. When you don't have sex for 5 years, what will be the effects?
There's no effect. There's no effect, eh? The only thing when I know is there's no effect. Just so far you are living your normal life and you are doing what is everything normal. There's no effect. And when you want to resume, you resume. Just that maybe the time when you want to resume, you may feel a little pain and all that. Finish. Apart from that, there's no effect.
Somebody's asking us a question on TikTok. Can small kidney stones be detected by scan? What do you mean small kidney stone? Yes, scan go pick up the stone. Maybe it might tell you there is a mass there. It might give you a sign depending on the operator. If the operator is very good, the machine is very good and very skilled, they go pick up. Sometimes if the machine get as a B or the operator is not very, very skilled, they feel miss some. But yes, scan go show you. They might not tell you to go further and do a CT scan to actually differentiate. So when you say scan, I meant like what are you talking about? Like an abdominal scan, ultrasound scan, abi? But if not that one, yes, it will definitely pick up. Yeah, man, yeah, man. I started noticing that I do get tired easily, and I do feel pain in my ankles. This started when I started working as a cashier in a gas station. Should I be worried?
I
Dr.
believe your
Israel.
work is actually telling on you on that. Can you hear me?
Yes, yes, yes,
Can you hear me? As
yes.
I talk, I believe say now your work don't dey tell on you small small. I believe say your work don't dey tell on you small small. So it go make sense say you they do your work with ease. I know say cashier work not dey easy, but as I earlier said, most of the time I keep on saying it that you don't need to sit in one place for a very long time. When you sit down for one
Mm.
place and you see say, or you stand for one place and you see say your body dey, they comfortable, you need to change. You need to take a walk. You need to take a break. Yeah, it's very important you take a break sometimes. Not be every time you go just sit down one place and or do they do one activities the way when you dey do am all the time. No, so sometimes you need to change activities. That's why your ankle can be paining you. That's why you can be feeling weak and tired. No one person don stress himself well, he must tire. There's nothing you can do about it. The person must tire. So try to dey take uh, time to take a stroll, time to relax your nerves. Even when you dey work, you can just take a few seconds or a minute or 2 minutes to walk, come out from that position, then come back. I'm not sure say anything will worry you if you do that. Dr. Fred.
Yeah, thank you very much, Dr. Israel. Hello. Let me see. Somebody is saying, I want the course. Okay, you want the course. Do me a favor. See the course. See this code. See this barcode on your screen. I don't know where you did, whether I hear you did. This barcode. After the live session, go back and scan them. Scan them. Just scan the barcode. Automatically, it will carry you go to the course. You go fit pay for them online, no fear. You go pay for the course, you go get the course. Any question wey you wan ask me about this content creation, I go tell you. Do you understand? So scan am, see the code for your screen. Anywhere you dey in the world, watch am. After you watch am, you can ask me a lot of questions, and I go definitely try my best and respond to you. Okay, let me see. Let me see. Let me see. Do we have more questions here? Oh God. Can ASAS marry? Good evening. Let me see. Can ASAS marry? I'm not seeing.
The answer now, okay. In those days, I used to say no, no and yes. But I think today I just want to be a little bit biased. Just for today, I just need to be a little bit biased. The answer is no. Don't get married because yes, those days I used to say yes or no because I want when you get the full knowledge of everything. But today I just decide to be biased, and because sometimes when we give you people the full knowledge, now that risky one now I want go do, now go do now to go do. I was watching something one day and they said the yes, and they said you have 25% chance of having an SS, and they say come on 25. That 25% is still small. They thought it would be 57. As far they have 50% chance of having AS and 25%, I beg you, may they get married. And then while until they start. So I
Hmm.
will advise no, don't get married. Go and look for go and look for somebody that is AA. In fact, if you are AS, I used to tell people, my friends, and even my students or those I'm tutoring or coaching, I used to tell them, I say, if you are AS, if you be guy, you dey like girl, as you dey shake am, e name not dey important to you, na e genotype dey important to you. You ask and say, what's your genotype? Just first know. So that if na AS, may you disappear. Or may you friend zone the person immediately. If you are a lady and a guy dey bug you, he don dey tell you how the heaven go take come ground and the ground go take go heaven because he don see you. The next question wey you go ask am na what's your genotype? Oh, if he say he no know, tell am make you go first go check am. If you don check am, make he come back. If na AS, friend zone the person, and because the issue of that follows having a sickle cell child, not be small thing. Not be small thing for both you, the parents, the child himself, and the society at large. It is not easy. Yeah, so please, we will not put those
Okay.
children for those kinds, for those.
Somebody say I watched Dr. Aproko video concerning AS, and he said yes and no. Dr. Israel don't tell you the reason why he's telling you no. Because when we tell you yes and no, and we let you understand that yes, it is risky, but yes, it's possible. And that risky one, you will come go put your head. And then when any problem happen, you go talk, say, but doctor told me that it's possible. Then why is this happening? It's possible, but the risk is very high, very high. And he has told you that that is his bias. Because when you can't go born pikin, maybe SS right now wickedness, it is wickedness, and it's something that is supposed to jail you and your partner. Not supposed to sleep inside jail for like 6 months first. Make una suffer because when I don't bring pikin come this world, we go suffer, and it's not nice. That is why we are hammering on no. It's not as if it's totally impossible. It's possible if you get money, but if you don't get money per se, me go tell you no. If you are very very broke, if you are from a poor background, no try am. Break up with that girl, break up with that guy.
Well,
Then
well, you come for a rich background, though. For me, now no, because if yeah, well, I said this thing. I said before, they always say yes and no. I will give you the yes part. I'll give you the no part. But I don't know. I told you today. I just want to be biased. That's why I said no. So it may not come look for me. Can't use cutlass cut my neck. So before I said the no, I've already said it that I want to be biased.
okay, let's take one question on TikTok. Good evening, doctor. Please, my woman lost her first pregnancy at 7 months before we discovered that she's O negative. Why will you be discovering you are O negative at 7 months? How? She no register for antenatal. Waiting. Why? Then what is the comment? I can't even see your comment. And she lost 2 pregnancy thereafter. So what is the question now? I can't see. Please, can she give birth again? Yeah, she can give it again. Just that you will need your woman will need to be managed by a specialist. Go and see a specialist as soon as possible. See a gynecologist. This mistake should not happen. Sorry for the loss. So sorry, but it's possible. Nothing is impossible. But your woman together, the both of you would need to see a gynecologist as soon as possible. I don't know why you would be pregnant and up to 7 months before you realize you are O negative. I don't know what happened. Honestly, we're not here to look for that. But it's possible. However, your woman would need to be managed by a specialist. So quickly look for one around you and book for a consultation and let them advise you and guide you and do all the necessary checks for the both of you. Huh? Yeah. That is the advice I will give to you here. Let me see. Somebody says, Doctor, you skip my question. Questions plenty. Oh. Good evening. Please, I have someone that always complain of weakness, and he has gone for some tests, thyroid, cholesterol, blood culture, and all was fine. The sugar is normal, but little BP. Please, what can really be the cause, and which test can such person go for again? Dr. Israel Abeg, respond.
That person should go to the hospital. That's the test he can go for again. Go to the hospital, because I don't know if it's hospital that did all these tests for you, or you just also went to one lab and told them that you're weak and they did all these tests. So please, you made the person go hospital. There's not like little BP. If you have hypertension, if your blood pressure is high, please manage it. There's nothing like little BP. Make you not come to see person come to get hypertension, you still say now, like some people will come hospital, you say, are you coughing? You say yes, you say a normal cough. Is there anything like normal cough? There's nothing like normal cough. If you get cough, you get cough. So the same thing, there's nothing like little BP. Your blood pressure is high, please work on it. If the person's blood pressure is high, you should work on it. You should not be looking at it saying, I beg you, I beg you. That I beg you, something fear happen. So the person needs to say a specialist, need to go to the hospital, let them work with that person, make them know what really they cause all these many these things.
Okay, the mistake happened in the hospital where they ran the blood group test. They gave a wrong result. It was a very deadly mistake. Thanks so much. I'm so sorry. I'm so sorry. No lose hope. No worry. No worry. No lose hope. It's not easy. Do you understand? You know they easy, but no lose hope. Your woman go carry belle go born. That is why I beg book for a consultation with a gynecologist. Do you understand? Sorry. Okay. Priscilla, we don't answer your question. I beg. We've answered you now. We did not skip your questions. I responded to you. I beg, Priscilla. We answer your question. I beg, please. Yeah, I know vex. My pregnant wife always complain of weakness and tiredness. Ah,
Now normal thing. That those are some funny things about pregnancy. The kind of symptoms whether they bring in all this world. So now normal thing. For you to the assistant. Not they let them do too many work, just the assistant. In every way you can assist her. So those assisting when you the assist her will also make her not to get this stress, and then we can't get problem. If you see they feel weak, but the weakness not go to cause anything to her.
thank you. One more, please, doctor. I want to ask that after like 5 times, the test shows HIV negative. Can that person still be diagnosed with HIV positive after 10 months, but not sure that the ladies? I don't understand. Dr. Israel, quickly, huh?
Even though you do test 1,000,000 times, even though you do test 1,000,000 times, the day when you want to become positive, you become positive. So yes, after like 5 times of tests showing HIV negative, the person can still become positive. That's what we call seroconversion. Now, these 5 times you did the test, I don't know how long during the durations. I don't know the duration from the first test to the second test to the third test. I don't know. But there's what we call seroconversion. There's also maybe this person is already positive self, and you are not aware. You do the test because of window period. Yeah, the test result will come out negative, and after some while, when you do the test again, it comes out positive. So in some cases, when you even do 2 tests 2 weeks apart, The first one you do will come out negative. The second one, by the next 2 weeks, will come out positive. Why? Because of seroconversion. This person is already positive before already, just that is within the window period where the test not go fit catch and say they positive. Then by the time it comes through, it means say the test don't dey fit catch and say it dey positive. So yes, it's possible. It can still become positive. It can still become positive. Dr. Fred.
Thank you so much. Let's go to TikTok and take one more before we disappear. Our time is almost up. Who be this person now? Let me see. No, sorry. It says, please, can you talk about swollen feet when you sit or stand for long? What is quite big? What do you mean by swollen feet? When you sit down for a very long time, it's what they call pulling, venous pulling. The leg feet swell up. That is why we advise to don't sit down for too long. And again, your body weight. There's a way you are overweight or even obese, you sit for too long or you stand for too long, your feet can get swollen. This is as a result of venous pulling. It's bigger than this, eh? But so you have to stand, move, don't sit for too long, raise your leg, and then move around. This would help you. It can happen to anybody though. Let me see one more question and then we move on. Oh God, okay, no more question here. Let me see. I asked another question. Drop it again. No time. When you don't have sex for 5 years, we've answered this one now. Please, doc, I always drink well, but I don't used to poo. I poo once or twice in a week, and I always drink water. What can I do, please?
If that's your routine, that once or twice a week, that's how you have been. I bet rest is normal to you. It's normal to you. So don't stress yourself. Don't stress yourself at all. Just leave on like that. Yeah. But continue drinking your water, because it's not only because of stool you drink water. And also another type of advice is that you should eat a lot of vegetable and fruits. Fruit like orange, watermelon, banana. Just eat a lot of fruits and still continue your drinking water and eat a lot of vegetables, because that will give you roughages, and those roughages are what will actually make your stool soft and make you stool almost immediately. Yeah. So no fear, no worry yourself. Say the quiz stool, or you dey stool once in a week. Yeah, some people are like that. Some people once in 3 days, once in 4 days. Why some people every day? So if your own is twice in a week, just calm down and enjoy the ride. Dr. Fred.
Calm down and enjoy the ride. In addition, you can, when you wake up in the morning, the first thing you do, you can try to take water. You can try to take water when you wake up in the morning. The first thing to take, it might help you. It might. But if this has been your routine before now, no issues, no need for you to panic. Sure, you get ahead. But I noticed that for some people, when they wake up in the morning and they take water, what I've always advised you to do online, take water when you wake up as the first thing before you start eating. It can also increase your bowel movement and help you go to the toilet. Okay, it's almost time to round up. Let me see. Is there any other question here? People are just coming. So this live session now every Sunday, 8 p.m. to 9 p.m. 8 p.m. to 9 p.m. If you come late, I'm sorry. We might not be able to respond to you. Share the video, share the live session. If you have not gotten this course on content creation, get the course. Yes, Nami do the course, and it will help you get this course. See the barcode on your screen. Scan them. It will help you. It will help you. I don't know how you want me. I beg you. I don't know. If I beg you, be like, this guy won't collect my money. Which concern me and your money. But I don't want you to come and start crying tomorrow, Dr. Fred. Don't start. My page. Don't carry belly. What can I do? It's time to go. Let me see. I'm looking for, okay, I can't see. Okay. A lady is what? A lady is feeling some obstruction in the lower abdomen. I think whenever she stresses herself, what can cause it? Is it likely to be ovarian cyst? Please shed more light.
Okay, and this what you gonna make me not answer this question because you don't even know, and I don't think it's you. You said I think whenever she's stressed herself, so you are thinking, you don't know. So it's not you, and you are thinking. Uh, I having obstruction in the lower abdomen. I don't understand when the person is having obstruction in the lower abdomen and you are able to see it that is having obstruction. When you say obstruction in the lower abdomen, uh, is pain the person may have, and that's what if you are telling us pain, we will understand. When you say obstruction, mean that there's a blockage. How can you say a blockage normally? And so I don't know if it's ovarian cyst. It's for that person to go and see a gynecologist, let them run investigation for the person, do a lot of tests, and from there they will know if he really have any obstruction, and they will also know whatever thing they go do for the person.
Good evening. Please, I did my hormone profile test. One of the tests shows I have low progesterone, and my pelvic scan says I have endometriosis. Your name na Paulina Felix. Paulina, abego, madam, who sent you for hormone profile? Madam, who sent you for scan? Abi na you dey scan yourself, na you dey test yourself, madam. Who sent you? After you have done all these tests, you supposed to carry this your result, go see your doctor, Paulina. Not be for you to go do hormone profile and an abdominal scan or a pelvic ultrasound scan, and then you carry the result come on social media. No, now, eh? You supposed to carry this your result, go see your doctor, wey send you for the test. Your doctor go sit down, look all the result, go come tell you say do this and do that. That is the best thing I can tell you here, because there is nothing we can do for you, whether you have low progesterone here or this and that. No, see a gynecologist as soon as possible so that they go check you, make you know dey waka from one place to the other. Make dem no go spoil your body for you online. Dr. Israel, may we take this final one on YouTube. I always feel sleepy each time I finish eating.
If you feel sleepy anytime you feel eating, either you have eaten overfeeding, so your body is tired. Normally, sometimes when people finish eating, then the hormones will start working, and the enzymes start working. Sometimes some persons feel dizzy, tiredness, and lazy to even stand up from where they are. So it's nothing. It's nothing bad. It's nothing bad. So if you are feeling sleepy and you don't have anywhere to go, please sleep and not worry yourself. Just sleep. Yeah, though. So I don't think it's something you should be troubling yourself about.
Dr. Israel, any final comments? We're out of time.
Okay. Yeah. There's final comment. First thing is, I want to thank everybody. I want to thank you for joining us today. As we said, our time is 8 to 9. And say when we say 8 to 9, not me say by 9 o'clock, now we just up like that. And by before that 9 o'clock, we don't wind up so that by the 9 o'clock, we say bye bye. And so, sorry for those people when we not answer their question. No verse. But as I did talk my final words, so I'll just put math for just 2 questions when I did see for you. One talk about pain for pregnant women at 7 months. So if that pain they be like say na contraction, like say you want born, sometimes na normal. And when you they come Brazil, his contraction, you just be say the belly they show you sign, they give you self hard labor go really be. So not to stress yourself. Take your talk to your doctor. He go tell you what to do. Drink water as you can. Try to rest and try to rest. Rest is very important for you as at that time. So please try to rest very well. Then another person they ask whether herbs and roots they more better pass tablets. Yeah, most of the tablets that you take are actually made from herbs and roots. They are made from plants, and some of them are made from plants. Yeah, so and it's not, herbs and root are not really, they are not superior to tablet. Neither does tablet is 100% superior than herbs and root. The only difference is the tablet is well constituted, and whatever thing where they do, they know am, and the dose wey go take do that thing, and the amount wey go take do that thing, we know am. So that one make am dey unique and dey very good. While for herbs and roots, most of the herbs and roots wey some people dey take, the things wey they take dey miss am fit damage your kidney, fit damage your liver even before anything. So that is the problem we are having with herbs and root. And those herbs and root, for some people, when they don't do their mixing, they not get dosage, so they go sometimes over drink am, and that can also cause problem, for them. So because of all these side effects, we prefer say you just take tablet that we know wetin and wetin e be. However, if na you with your own hand go buy some buy these leaves, these leaves, you know the leaf by yourself, you wash am, you drink you wash am, like sometimes you say ugu leaf, there's punky leaf that you squeeze and drink the water. Nobody go tell you say that one dey bad, because and na herbs, if you don't know, na herbs. Those vegetables you eat, they are all herbs. So if you wash those ones, those important ones that we all know, and you drink it, and you wash it with water, not be with ogogoro or shekpe, you not use all those kind of things, then you will be helping yourself. I beg, don't go and buy the one when people don't make, when you don't know what they put to. I get so many stories of people where do such thing and where they land their self put. So I want to say a very big thank you for following us, for joining us, for always listening to us. And you have done well. You are the real VIP. And Dr. Fred, thank you so much.
Thank you very much, Dr. Israel. Thank you for watching. Don't forget the program now every Sunday, 8 p.m. to 9 p.m. If we no respond to you, no vex. We know if we respond to everybody. And if you come late, I beg, try not to come late next time. And for those people who never still get the course on content creation, scan this code on your screen and get the course, so that you no go cry tomorrow and say, had I know. Take care of yourself and have a wonderful week ahead. Like I always tell you, good life now waiting. Good life na sense. Bye-bye.